what you get when you're forced to buy something. It's that you are inadvertently signing up for all the rules, regulations, and restrictions that come from being a part of the plan. Do a pretty basic analogy, which I'm guessing a lot of us here in Arizona can relate to. You may be aware that we have had a bit of a housing bubble that has more than slightly burst. Well, during the bubble portion of it, most of us, or many of us, got mortgage contracts where the front page was in this big, bright, bold font that said, here's your $800,000 house, here's your no money down, here's the $10 a month it's going to cost you each month for your payment. And don't worry about the other 30 pages that are there in 8-point font. Don't worry about the fine print. It's never going to be an issue. There'll be no problem with it. Don't worry. We're all worrying about it now. Because it's the fine print that gets you. It's those rules, regulations, and restrictions that come around to get you. So that's why being forced to buy insurance is bad. And interestingly, or importantly, Prop 106 also protects the right to choose not to participate, for example, in health information systems if you don't want to participate. This isn't to say, by the way, that, for example, in my office, we have an electronic medical record system for our patients. This doesn't say that you can tell me, if you come in to see me, you can't keep my record of you coming to see me for your knee problem in your system. What this is saying is that if you don't want to participate in a government-coordinated system where all of your personal health information is going to be stored, you should have the right to choose not to participate in that. Because I would make the case, and I suspect that all of you would make the case, that there is nothing more personal than our personal health information, and we ought to have the right to control who gets access to that. We can come back to that, and we'll come back to that later on.